cancer screening is not a one-size-fits-all approach. Various screening methods are available, and which screening method you should use is totally dependent on your own individual factor. So today, let's explore which one may be right for you. Let's talk about breast self-exam. Breast self-exam involve women checking their own breasts. We recommend women in their early 20s to start doing their breast self-exams at home. Being breast aware and then promptly reporting any abnormalities you may find on your breast self-exam to your healthcare provider is essential. If you're interested in learning how to do a proper breast self-exam, you will find a helpful video on our YouTube channel where you can follow along at home. A clinical breast examination is the physical examination of your breast done by your healthcare provider. This can be very useful for women of all ages and is traditionally a part of your routine checkup. If you're interested in having a clinical breast exam, please speak to your healthcare provider about this. Let's talk about mammography or mammogram, which is the most common method used for breast cancer screening. A mammogram is when we use X-ray images to view both breasts. This is probably the most suitable screening method for most women, and it is most useful for women who are 40 years or older. A breast ultrasound is often used as an additional method if a suspicious abnormality was found, for example, on a routine mammogram. Typically speaking, an ultrasound is not used as a standalone screening modality. It is, however, extremely useful in women who have dense breast tissue, as it can detect breast cancers in those women where mammogram may not be able to. Breast MRI is often recommended as a supplemental screening modality for women who are at high risk for developing breast cancer. And that can include women who have a strong family history for breast cancer or those who may have a genetic predisposition towards breast cancer. Breast MRI will provide a more detailed breast image. However, MRI is generally not recommended as a primary screening tool in the general population. Tomosynthesis, or 3D mammography, is an advanced breast screening tool. A 3D mammography uses your standard two-dimensional breast images stacked in layers so that the radiologist can see a three-dimensional view of your breast tissue. If you're reported to have dense breast or extremely dense breast on your standard 2D mammography, then I think it's a good idea to pursue supplemental imaging. And this may include a breast ultrasound, MRI, or 3D mammography. A breast biopsy is only performed when a suspicious abnormality is found on your screening imaging, and that may be calcification or a lump. A breast biopsy is a minor procedure that is usually performed by the radiologist. It is when a very small sample is removed from your abnormality and it's given to a pathologist who examines this under a microscope to see if indeed there's breast cancer there. A biopsy becomes the most definitive way to diagnose breast cancer. Understanding these different screening modalities and feeling confident to discuss these with your healthcare provider is essential in promoting your own breast health.